So let's talk about one of the newest breakthroughs in the treatment of spinal stenosis. So what is spinal stenosis and what is this implantable device?
Spinal stenosis is the narrowing of your spinal canal. So the facet joints develop arthritis in them, as we have been talking about. Then there is also ligamentum flavum, which covers the spinal cord. That also gets thick.
So the spinal cord canal or whatever
Spinal
tube
canal.
gets smaller and smaller.
Right.
And then the nerves that are affected?
Right. It also affects the cord itself, which are coming in the center.
The cord?
Cord.
Okay.
Or the nerves which are coming. Like the nerves come on, the spinal cord extends up to L1, the top of the low back. Okay. And after that, nerves are divided. So it affects them in the center, but above all, it also affects them as they exit into the foramen to the outside. So the narrowing of this, that is called foraminal.
So these people get pain relief when you lean forward?
That's right. What they call it is a neurogenic claudication, because of the nerves get hungry, so they hurt. So there is vascular claudication and neurogenic claudication. Vascular claudication is because of the blood vessels, there is not enough blood supply. Here it is neurogenic. Now when you bend forward, your foramen gets smaller. So your foramen gets better, bigger, so you don't hurt. That's
so when
why
you're forward, you're basically taking pressure off your nerves.
That's correct.
Is that right?
If you see many people who are walking around bending forward because they have severe spinal stenosis.
Okay.
So like shopping cart syndrome, that is what we call, like when you go shopping, that's the typical
You have to lean on the cart? Really?
Lean on the cart, that helps, but once you let the cart go, as you are in the checkout line, you have to extend your back, then you start hurting.
Because when you go straight up, you're pinching the back.
That's correct.
Part. So this implantable device, what, goes in there and like...
Right. Once we identify that, there are some contraindications, but once you rule out the contraindications, we put a titanium prosthesis. The one I use is called Vertiflex, and we put that in between our superion made by Vertiflex. So we put between two spinous processes, so it keeps it open.
So they could actually sit up straight or stand up straight.
Right. It doesn't bother them
anymore. What kind
of
results are you seeing so far? It's working?
So far about 70%, 70, or somewhat better than that.
Is that right? So spinal stenosis, so it's much different than the way you've been treating spinal stenosis in the past.
That's correct. There were lot of things in the past, but they were all coming and going, but this one has been there for 5 years now, and we are seeing long-term results. Patients who had initially about 5-6 years ago, the results are still good in 70-80% of the patients.
Now, at your centers, because you guys are a progressive center using all the new stuff, is it true like less than 10% of doctors are even doing this method of putting this implantable device for spinal stenosis?
Yeah, that is an extremely small percentage of the patients who do that procedure. So in our area, I would say in entire Western Kentucky, I'm the only one who does those.
Right?
Even other doctors in my practice are not doing it. I'm trying to encourage them, but...
So within 2 hours of your practice, would you say there's thousands of people that could benefit from this?
Yes.
That don't even know it exists?
That's correct.
And we have animation that shows what you're doing. So we'll look at this animation. So I guess you just put it in there, opens it up, and they feel better.
That's correct. It is pretty, even though you have to cut, it is a surgery, but it is considered fairly minor surgery because we're not really cutting any bone. It is only the muscle we are cutting, and we get up to the ligament area, and then that's it.
And it works.
It works, yeah.